Hello to our Gold participants from around the world. I'm Fiona Lang Sharp, IBCLC Public Relations Manager and MC for Gold Learning. Well, I'm chatting today with Dr. Sue Hall, who is going to be presenting at our upcoming Gold Neonatal Online Conference 2017. Welcome, Sue. It's great to have you here today.
Thank you so much. It's great to be here.
And you're going to be presenting on evaluation and stabilization of the sick newborn, which sounds like a really big topic. So I'm very excited to hear what you have to say about it, and what happens and what we can do in order to stabilize those babies. But first of all, I'd love it if you would introduce yourself to our listening audience today. Tell them a little bit about yourself, and then tell them perhaps what your practice looks like on a day-to-day basis now.
Okay, well, I'm a neonatologist and I have been for many, many years. And I also spent many years teaching medical students, interns, and residents clinically about neonatology. So that is kind of my interest in this topic, is that when I was an intern and a resident and had to go to the delivery room, I used to be kind of terrified, like, oh my gosh, what is going to happen? What is this baby going to have? How will I know what to do? And over the years, it became very clear to me that it's actually very easy to figure out what's going to happen. If you take a history before you go into the delivery room, it can point you in certain directions, so you can actually anticipate what diagnosis a baby might have and respond in that way. And then if it doesn't seem like you're on the right track, you can alter your thinking. But my whole goal is to make it kind of easy and straightforward for practitioners going into the delivery room to have an idea of what they're going to be facing so that they can be more prepared. So just all of my years of experience, from large academic center NICUs to small community hospital NICUs to doing transport. Um, I've taken care of and stabilized thousands of babies, and I've just kind of boiled it down and
Wow.
trying to make it simple for everybody.
Well, and that, of course, not only makes sense, but is somewhat comforting, because it can be very overwhelming, and in those situations, sometimes can have many factors that can cause or disrupt, even thinking about what to do next in those situations. So you did touch on a little bit. I can hear you're very passionate about this topic, and with all of your experience, perhaps you can tell me or elaborate on, even when you were perhaps studying this again or putting this together, were there things that you thought about that you just know are important to you, or over the years when you've been working, that really strike you as being the most important in these situations?
Well, I think two things are important. One is looking at the baby and having really good clinical skills of evaluation, the baby's color, the baby's tone, activity. Um, so that's number one, is always not just focusing on the numbers, the saturation, the heart rate, etc., but looking at the baby. The second
Right.
thing that I'm going to be doing in my presentation is showing a lot of different x-rays, because
Mm.
often babies present with respiratory distress, and it may not be entirely clear what the diagnosis is. And so I think that everybody should have kind of a basic ability to read x-rays. I mean, there's a pretty typical x-ray for respiratory distress syndrome. There's a pretty typical x-ray for transient tachypnea. And even though nurses, for example, might not receive a lot of training about reading x-rays, it can be instructive, and it's not that hard. So that's going to be a big part of my presentation, is looking at the x-rays of these 7 common conditions that I'm going to go over that we see in the delivery room.
Well, that sounds wonderful, and we'll look forward to hearing and seeing more. It's always great to have those visuals for better understanding, for sure, and learning. So lastly, before I let you go, perhaps you could just tell us what are you hoping that the delegates will take away from this presentation for themselves, and perhaps what you anticipate they'll be able to use in their practice.
Well, I'm hoping the delegates will just become more confident going into the delivery room and have a better, more clear thought process, kind of like a decision tree about what a particular baby might have when they're called to attend a delivery where maybe a baby's in distress, or when they're called after a delivery to look at a baby who's having some trouble, that it won't be that difficult for them to figure out what's going on. Um, if they're a physician, so that they can take care of the baby and get things in the right track, and if they're a nurse, so that they can know what critical factors in the history and evaluation of the baby to report to the physician, so that it will become fairly clear to the physician as well what the diagnosis is. I mean, a nurse should be able to make an assessment and a suggestion of what's going on, instead of just presenting random numbers, the
Mhm.
baby saturation and respiratory rate. Try and bring everything together into an assessment of what's going on. So that's what I'm hoping to do, is give all of the practitioners confidence in their ability to go into the delivery room and evaluate and stabilize a baby who's sick.
Well, that sounds wonderful. Thank you for that. I really appreciate your explanation on there, and decision trees can be so valuable in those times. So thank you for that. Well, thank you so much, Dr. Sue Hall, for sitting down and chatting with me today. It's been lovely having you here.
Thank you. It's been a pleasure. Looking forward to my talk.
Yes, as we are too, and we'll look forward to seeing you at the full conference for our Gold Neonatal Conference. And I can see that you're going to be presenting on Monday, the 15th of May. Go to our website, everyone, at www.goldneonatal.com to check out all the local times that our speakers are speaking at. Well, thank you again for joining us today, Sue. It's been great chatting with you. And to our listening audience, thank you for joining us. We look forward to having you back soon again. Bye bye for now, everyone.